there's so much investment in healthcare right now.
What is charge capture?
They now have to understand. They have to be involved and they have to be engaged.
Hello and welcome to the RevTech Rx Podcast powered by Streamline. Today, we're at the HFMA annual conference. I'm David Kozlowski. Alongside me today, I have Lawrence Kessler, the SVP of Growth and Partnerships.
Good afternoon. Go Dogs.
I'm glad you're here. And next to him is Zach Johnson, the VP of Solutions at Avlead.
Hey, welcome. Glad to be here.
Yeah, awesome. And today we're going to be talking about the price transparency mandate and should we care? A little bit of a controversial topic, right? But I want to set the scene here. I've got a couple simple questions, and then we'll start to deep dive into it. Does that sound good?
Good deal. Yeah,
awesome,
let's rock and roll.
Awesome. All right. So the first thing is, do you believe that today people are actually using the price transparency?
That's a good question. Today, I actually don't think that it's very helpful to patients. I don't think the spirit of the mandate is matching the reality of it. I think it's being more widely utilized by insurance companies, consulting firms, CMS to gather information. I think that it is an entirely complex system for the patients to truly understand, and it hasn't been simplified enough to make it digestible at the patient level just yet.
Sure.
Yeah, I mean, I think that's the biggest thing is a patient can't digest that information. They get a CPT code or a procedure, and how are they supposed to know where that's going to go? And then with only, I think, right around 50% of hospitals are compliant right now.
Yeah.
I mean, how would you even be able to tell if they knew it was valuable? Because half of them don't even have anything up right now, which...
Yeah.
Well, it's a great point. So you said 50%. I actually read an article today, very, very timely, that actually has conflicting numbers as to who's compliant, who's not.
Okay.
So a group called Patient Rights said 16% of hospitals as it stands today are compliant. Milliman, another firm out there, said 68% of hospitals are compliant. And then CMS issued a report that said there are only 160 hospitals that are out of compliance. So I guess that begs the question of
What is compliance?
what is compliance? So
Yeah.
that's why it's not really valuable, because I feel like it's just very much disconnected and all over the place right now.
Yeah. Were you going to say something?
No, I was going to say that goes into the compliance part is the rules are so generic that you could say you're compliant. I'm going
Right.
to say you're not compliant.
Yeah.
And it's truly what is the definition? Because, I mean, CMS, when they put this rule out, said it should only take 150 hours to become compliant. And that's just not the truth, where you could do 10 minutes and upload an Excel file and
That's right.
be compliant, I guess. But
Yeah.
there's so much gray area in that.
The overall idea of price transparency, do you believe that it is something that will be eventually or could be helpful to patients in the future?
I do, and I think it's something that is necessary to help people understand what they owe and their financial obligation. I don't know about you, but I've received many, many phone calls from my parents where they receive something in the mail that clearly states explanation of benefits, this is not a bill. And then my parents call me and they say, we just got this huge bill. I don't understand it. Can you help me?
Yeah.
And so not just even with that older population, but just today with the consumerism and the ability to shop around, I think it's important. But like I said earlier, it's an entirely complex system that is going to need to be simplified and make it digestible. And I do think there's a need for it, especially as margins get smaller and smaller and hospitals need to make sure that they're able to collect from the patients. It's a huge revenue stream and they can't afford all that money going to bad debt.
Sure.
And it's really, with that, it's complex, and the hospitals, the insurance providers, everybody needs to find neutral ground that's beneficial for all of them, because right now, some of the hospitals don't want to comply because you're going to lose your competitive advantage.
Mm-hmm.
When you go to the contract with some of the insurance providers, they're going to know your prices that other providers are paying you, or insurance providers, and really, you're going to lose that where they can see what you're paying with everybody else.
Yeah, I mean, but that's not as black and white as it seems either, because, well, first of all, many places, they don't want to post their negotiated rates, and that's the reason why they opted out or chose to not be compliant. But at the same time, if I'm hospital A, I could post my negotiated rates in a spreadsheet, but there's a lot more to a managed care contract to interpret.
Right.
And so it's not as simple as saying like, oh, hospital A down the street gets paid X for an MRI. I only get paid this, so I'm going to go to Blue Cross and tell them they owe me more. There's so much more nuance when it gets to a managed care agreement too.
And I guess that begs the question, are we ever going to get to a point where we have true price transparency? There's a lot of logistics that go into it, right? I mean, Zach, I think we were having a conversation previously about, well, you can post the price, but then like insurance covers X, and then there's all these other avenues. Is it possible to really know how much money I'm going to pay when I go into that hospital for a particular procedure?
I think it's possible. I think we're taking the right steps. So, Price Transparency Act, the health plan transparency rule that goes into effect, where insurances and other providers of insurance have to publish their rates with their insured group. So I think that we're going to get closer where because unless you know your deductible, your out of pocket, where you're at, it's going to be really hard to know what you're going to owe for each visit.
Yeah. And we're here at HFMA in Denver, and we're in the exhibit hall, and there's lots of really, really good organizations here. So I do think it's possible. The technology in healthcare technology, quite frankly, is behind other industries. But there's a lot of innovative and really cool technologies at companies that are here exhibiting. And I think with access and improving the real-time eligibility information, improving the ability to send information to the patient via your mobile device, and eliminate having 4 different bills come to your house, but have it all in one app on your phone and simplify the process, I do think we can get there. I just don't know how long it's going to take.
Yeah. And Lawrence, you're talking about it already, but my next question was, what is the future? If you had to envision this crazy dream, what does it look like for the patient, and how do they get real price transparency?
Yeah, it's a challenge, right? So a lot of organizations have implemented patient estimation solutions on their website. But as a patient, if I go and type in knee surgery or knee replacement, there's going to be, as you mentioned, Zach, a list of codes that don't really make sense. I'm going to have 15, 20 things to choose from. So we got to simplify that process, and maybe that comes from your referring physician's orders to say, here's exactly the code that or the procedure you're going to have, and put those guardrails in there to say this estimate is going to be X% accurate. But I do think simplifying and explaining the bill to the patient, and we're getting there, right? I think once we get there, that's what the future should look like. It's like I said, it's just going to take us a while to get there.
Yeah, I totally agree 100%. There's not much to disagree on that. It's really just making that simple. Make it that easy app that you can look on your phone, break down, explain things. What's this insurance adjustment that's on here? What does that mean? What does that pull from my deductible? Those types of things that anybody could pick it up and figure it out. That's...
Yeah, and then it also gives the patient options on how to pay what they owe. So I can pay the full balance now if it's a smaller balance, it's something that I can afford. Or if I have a higher deductible and it's like $2,500, $5,000, and I can't afford it in one fell swoop, what are my options to put it on a payment plan? And you could just click a button and it takes you to one of these organizations that do the payment plans or non-recourse loans or whatever the case may be, and you give the patient multiple options to solve that financial burden.
Yeah.
And there's really incentive for the providers is when people get it on their phones, they pay.
Yeah.
If you get it in the mail, you're probably not going to pay. But if you get a text say, hey, you owe $20. Oh, yeah, I did go to the doctor last week. You're going to click it. If it's nice and easy, you're going to pay it. So, there is benefits to being that transparent and letting them know right away, because it's going to benefit everybody in the long run.
That's right. Hey, people ultimately want to pay their bills.
They do.
Yeah. So I guess that brings up a question. Should the hospitals care? And there's a bunch of follow-ups from that. And I want to kind of touch a little bit on it without getting too, we don't want to call anybody out, but should the hospital really care about price transparency today, with given the fact that, sure, they can get a fine, but is it a beg for forgiveness? We'll wait till we get the fine, or?
Zach, you want to start?
Sure. I think they care because it's all about patient satisfaction and making it as easy as possible. I just don't think with everything that's been going on in the last 2 years, it's been their top priority. Where, they're dealing with staffing issues, they're dealing with COVID.
That's a good call.
It's one of those things that they'll get to it when they get to it. Like most revenue cycle solutions, it's at the end, so they'll get to it. But I think it's something that all of them are going to say they care and they do want the best experience for their patient. So I think it's something.
Would you say it's unfair, the fact that the government was saying, hey, we want to do this price transparency mandate, you don't get it done, we're going to find you during such a unprecedented time, in a sense?
I think it depends on who you ask. Where CMS says it's going to take 150 hours.
Yeah.
I think it's just so gray in the area of what is the requirement. Because if they think it's 150 hours and it's costing some companies, 1,000 consulting hours to get there, if you're going to have to pay almost $1 million in consultants to get there, what's your trade-off? That's pretty close.
So, it's assessing the risk, really, right? So the first year of the mandate, we came out 2021. I believe I don't think there were any penalties issued. It was a lot of, you're not in compliance, please send your remediation plan. How are you going to address this and become compliant? But it was also what the stated penalty wasn't necessarily severe enough to say, I'm going to invest to do this. I'll just take the penalty if they give it. And it wasn't until recently we actually heard CMS issued $1 million fine to a system in the Southeast. But my understanding is, they just disregarded the notification and just said, well, we're going to take the fine and we're just going to deal with it. But that's one out of 4,000 hospitals in the United States.
Right.
I think like Zach said, hospitals are now in the business of patient satisfaction. Everybody has a choice of where they want to go. So they want to make it easier. But that goes back to your original question: are the patients really looking at this now?
So do they know? Yeah.
Yeah. So once again, it's going to be educating the patient, letting them know that these tools are out there. But the hospitals do care because it allows for them to then take care of that patient liability before service, and making sure that it doesn't roll to bad debt or something that's not collectible.
Sure. Yeah. I think one thing I am curious on. Let's take a second to think. We're talking about a lot of positives, right, of price transparency. What are the negatives? And an example here that I'm thinking about is, if you're a hospital and you're a hospital, you have lower prices. Am I going to go to you? And then does that affect patient care? What are the repercussions, I guess, of exposing your prices?
So my own personal opinion, I'm not going to the lowest cost provider when it comes to my healthcare.
Sure.
And I think a lot of people probably feel that way. So, for me as a consumer, and maybe I'm a little bit different because I'm in the industry, but I'm going to go look at, people's scores and the quality, and I'm going to go to places that I get references and referrals, and I'm not necessarily going to be as cost sensitive for a specific procedure as long as I get the outcome that I want. So that to me, I think, is a big component of it. I don't think people are price shopping to find the Groupon of healthcare.
Right. No, it's really about exactly what you said, that quality of care. I always think of, how is there not a Yelp for physicians where it's that easy, where you can look it up and be like, well, this person has 2,000 reviews, 5 stars, but they have, $4 signs.
Yeah.
It's my health. I'm going to want to go to that physician over, somebody that doesn't have a review like that. So I think it's, getting to that point of, then you can shop around and be like, oh, well, it's just my ankle. I just need an x-ray quick. I think I'm fine. Yeah, I'll take a cheaper option.
Right, like if it comes to cancer care or a cosmetic surgery or something along those lines, you're definitely not going to the low-cost provider that has $1 sign and 1 star, right?
Yeah. What would be a negative of this whole position? Is there any, we're hearing a lot of upside, but if you're at the hospital, what's the negative?
I think the negative is you have to give out a lot of information about your organization. Now, as we said, it's not easily interpreted, but your risk is, I think that I have the best rates in town, and now I'm giving access to a lot of information, or Blue Cross or United or these big payers are going to come to you and say, hey, we just benchmark you against everybody else and we're paying you way too much. We need to renegotiate your contracts. So maybe there's going to be a hit there, but quite frankly, they should already know anyway. So I just think it's a lot of man hours. It's a lot of effort.
When you say that, I got to ask. So other than not, I feel like I've seen a lot of companies advertise that there are solutions to make this happen. Is that false statements, or is it a combination of solution and man hours, or?
So I have spoke with many hospitals over the past couple of years that have gone down the path they tried to do it themselves, and they have day jobs. Mm-hmm. And like Zach said, they said 150 hours, way more than that. It's very complex.
Sure.
And so they go and look out for outside help. And so some firms have done a really good job of having their methodology in place. They do it, that it checks the box for CMS compliance. They're good to go. So if it were me, if I were CFO of a hospital, I'm probably not going to task my already stretched too thin team with another project. I'm probably going to go reach outside to a firm that I get that has a good process in place, a referral reference, and I'm probably going to hire them to come do it just to check the box and make sure they update as required by the government.
Sure.
And with that, I mean, there's still not the guarantee that you're going to meet compliance by getting that third-party firm, because you might spend money and get that done, and then CMS comes back a year later and says, well, you were almost compliant. You still need to fix X, Y, and Z. And so then that's a risk for those companies as well, where, that's what goes back to the requirements need to be very clear of what needs to be, true price transparency.
That's right. But at the same time, we haven't seen anybody get fined that got notification of being not in compliance and then followed up with, well, here's our action plan.
Yeah, here's what we're trying.
So as long as it's kind of like, the cover-ups are always worse than the crime, right? If you show good faith, good effort, I think CMS is going to be willing to work with you to make sure that you don't get fined just to get it right. But listen, things change. They change quickly, so you never know what comes next year.
If anyone's watching that's a hospital, if you had one pro tip to get started, what would it be?
I would leverage your network to find out what you've done, right? So if you get a notification of noncompliance, talk to your network at the HFMAs and the other organizations and say, all right, well, you're compliant. What did you do differently? Because here's what we did. And share those informations. Like, we just have a huge network of really smart people with where we are. And so I would leverage that group of people to find out what did I do wrong that you did right, and try to follow that roadmap.
For sure.
And you can even go, look at your competition, go see what, they're doing that makes them compliant. It's all on their website, because that's part of being compliant, and just making sure you have all of that. And I think to go along with that is patient education in that same space is what, not only are you compliant, but how are they presenting it? Getting that good education documentation outside. Yeah. It's easy and clear, so your billing office isn't getting blown up with questions about this estimate and all these prices and what do they mean for me.
Yeah. Educating the patient, but also educating your staff.
Right.
So when you get those phone calls and you have your patient access pre-registration people, they're able to really articulate and explain how we got to these numbers. Here's your deductible. Here's what you've paid to date. Here's the cost of your procedure. Here's what you owe. How would you like to handle your bill today, right?
Sure.
And then give them options. So staff education, patient education, all the things. And then also being able to train your customer service staff to really, have that patient-facing soft, feel, right? And it's customer service, man.
Yeah, that's great. Any final thoughts about price transparency when we're heading?
It's been a lot of work for a lot of people, and it's been very challenging. We deal in healthcare is very, very complex, as we have said over and over, and to try and boil it down to price transparency at simplest is not that easy.
Yeah.
So I think we'll get there. There's a lot of really cool, innovative companies that are simplifying the process, but it's been a lot of work. And then right off the heels of that, we have the No Surprises Act, which is a whole other podcast conversation we don't even want to get into. But yeah, it's one thing after another. So I think the focus on the patient satisfaction component, making healthcare easier, more digestible for the patient, the spirit of it is right, but getting it to in practicality is the difficult notion.
Sure.
Zach?
Yeah,
I'm in the same train of thought as one bite at a time.
Yeah.
I think it's not a simple answer because it's a complicated problem. Like you said, it's going to be one bite at a time. Next year, we can come back to the same conference and say, where are we now from where we were last year? And where's the next step to get, to where we need to go? Because it's going to be, that eat an elephant one bite at a time until we get to, somewhere that works for everybody.
Yeah.
We'll probably have a lot more gray hair and the whole deal when we get back here to talk about this in a year. So
no, that's fair. I thank you guys so much for your expertise and joining us on the podcast, talking about price transparency. And thank you all so much for listening in. Again, I'm David Kozlowski with the RevTech Rx Podcast, powered by Streamline. Take care.